The emergency contraceptive pill. If a woman has sex without contraception or her method fails, she can avoid pregnancy with emergency contraception if it's taken within 5 days after unprotected sex. This video tells about emergency contraceptive pills and how to use them to prevent a pregnancy. Emergency contraception can be used anytime a woman is worried she might become pregnant. For example, after any unprotected sex, including rape, or after mistakes using contraception. Ask the woman how long ago she had unprotected sex. Emergency contraception only prevents pregnancy within the first 5 days after unprotected sex. The sooner it is taken, the better. It only works for one act of unprotected sex. If another act occurs, then she needs to take it again. Explain to the woman that the emergency contraceptive pill can only prevent a pregnancy from starting. It cannot stop or end an existing pregnancy. It does not cause abortion. If a woman accidentally takes these pills before she knows she's pregnant, it won't hurt her or the pregnancy. Pills specially made for emergency contraception are available in many countries without a prescription. These specially made pills are the most effective and are made in one convenient dose, either one pill or 2 pills taken together. If these special emergency pills are not available, many kinds of regular contraceptive pills can be used, though they are most effective within 3 days of unprotected sex. Any brand can be used as long as it provides the amount of estrogen and progestin required. The copper IUD is also used for emergency contraception. In fact, it is the most effective method. It needs to be inserted within 5 days after unprotected sex and provides highly effective contraception for 12 years. Emergency pills are safe for all women. Rarely, these pills might cause some nausea or vomiting, a little abdominal discomfort, or a little vaginal bleeding for a few days. If she vomits within 3 hours of taking a dose, the dose should be repeated. The woman takes the pill now. To stay protected from pregnancy, she should begin or restart a contraceptive method. Almost any method can be started on the same day or the day after emergency pills are taken. However, if a woman takes ulipristal, also known as ELA, hormonal methods are started 6 days later. Women need to avoid sex or use condoms for the first week of using the contraceptive method. No matter what method a woman uses for ongoing contraception, mistakes happen. Consider giving women, especially adolescents, first-time contraceptive users, or those using less reliable methods, a pack of emergency pills to keep on hand, just in case. Remember, emergency contraceptive pills prevent pregnancy. They must be used within 5 days of unprotected sex. They are safe for all women.